Hi, everyone. We're back again, Unite to Heal 3.0, doing this again. Very, very excited to be here. I've been blessed and honored to be part of different panels and to moderate, but tonight's panel really, the content here writes itself. We're here with world-renowned Dr. David Pelcovitz, Dr. Hindie Klein, and joining us is the next generation, Dr. Malky Mayerfeld and Karen Herrmann, social worker, their daughters, who are the up and coming, or I could even say the already giants of today's clinical world. I know because I work with them a lot and they're amazing. Dr. Pelcovitz and Dr. Klein have given so much to the community. They have done so much for individuals in their private practice. It's incredible, really. I mean, everywhere we go, Dr. Pelcovitz's work is being recognized. He was a trailblazer in the research that he did so many years ago. And Dr. Klein, with all the community and involvement, TICVA so many years ago, and the task force, which is, how many is it? 44, 45, 48 organizations now?
We're about 40, 42 organizations, yeah.
Amazing.
26 years old.
So my first question tonight for Karen and Malky is, you grew up in a home with such amazing parents who were doing so much for the CLAL, for community work, as well as the mental health community in general. There must have been some impact, some relation between that and you going into this field. So was wondering if you feel comfortable to share a little bit about that and your choices in your professional careers. Karen?
Yeah, sure. I'll jump in. I have some kind of funny, fond memories of sitting in the back of our car growing up. I think it was, one of those, old school minivans, and with my, maybe going to some extracurricular activity or whatever it is, and my father shuttling us around and being on one of those old, the first edition cell phones, car phones, with his, little wired earpiece, and talking, and being on the phone talking to whoever he was talking to, and I obviously only heard, very minimal one side of the conversation, and didn't really know what he was talking about and or who he was talking to. But I sort of remember sitting there and playing a little game in my head of wondering like what, well, what's going on here, and I guess as I got older, starting to wonder a little bit more, what would I say, or sort of taking it to that next step. So that's sort of like an old memory that I think about when I think about, what it was like growing up.
That's so nice. The, kind of already feeling like it was like important, and the kind of curiosity for the mental health field, and trying to problem solve, actually, like what would I do? It's amazing. That's amazing. Malky?
I think it's, I think several things, have impacted me in various ways, being that my mom is amazing psychologist, psychoanalyst. First of all, I think having a successful female role model who is so active and shared of herself in so many ways, just seeing a woman like that. I feel like when we were growing up, maybe there weren't as many women in, in like the public, sphere. And now I think having that role model is number one, like extremely impactful and inspiring. That's number one. I think I really feel that growing up in a house where you have a therapist as a mother, all jokes aside, which of course everyone's saying, I never had, like, I'm doing great. Great. No, I'm serious. I'm just joking. But I really feel like my mom was able to like imbue a real psychological mindedness in our house. And we were able, as kids, like that was cultivated in us. And we were able to really learn how to understand things and have an emotional vocabulary. in a way that I think a lot of people didn't, and even now a lot of people don't necessarily. So that's almost like in my blood, so that when I ultimately became a therapist, I feel like it's something that's so familiar to me, you know? And I think also what we were saying before, that I think just seeing a parent who is so involved and contributing to the community left such an impact on me that made me always see that as something like a value, you know, that I would want to strive towards. And I'm trying to, you know, now like as more, you know, my kids are a little older, I'm able to do that a little more, but that really left an impact on me and continues to inspire me because, you know, my mom does so many different things for so many different people. So.
Yeah, that's so nice. Malky, bring up, you know, really important point that so many, you know, your mother was able, Dr. Klein was able to imbue in you like a psychological language, words for experiences in life that really a lot of people didn't have. And like you said, still to today, a lot of people don't have.
Well said, Malky. I also just want to say, like, I think that, you know, just back to that question, people always used to ask me that, or still do, I guess. And I always kind of was like, didn't quite understand the question, because I guess to my father's credit, it wasn't really a thing. Like, he was just like,
I love that.
so
Yeah.
I think so some, you know, definitely I am so on board with everything that you're saying, but I think that there's also an element of that in there.
I just have to acknowledge, like, my heart just like got like washed over, like with this like nice warm feeling with both of you, because, you know, like the words you just like my father was just my father, and I have goosebumps, you know, the things that we all do.
You savor that.
Yeah. Can we sit with that for a minute and just appreciate that we had, but really, like, not saying this because we're on a panel or to make anybody feel good, but how important is that? Just that you can say, like, my dad was my dad, and like, good, you know, that's.
But, you know, I have to just
so
say
beautiful.
what that speaks to
Mm-hmm.
is David's, besides his incredible brilliance and expertise and all these things, it speaks to his humility, because to his children, he was not the big world-renowned psychologist who was publishing when no one was publishing.
Mm-hmm.
He was Abba or Daddy or whatever you called him.
He was the guy driving them to soccer or whatever extracurricular.
Basketball or something.
Yeah, it's
So
amazing.
He was just their father.
Mm-hmm.
So, and I think that speaks to his incredible humility and his incredible humanity. And
I made a deal with my wife when we first got married, and she knew I was going to be a psychologist, that I would never play psychologist with the kids. I would leave that at the office door.
Yeah.
So it was a deal and a promise, you know, at the very beginning.
That's even till today, when I need to ask my father, you know, whether professionally or personally, a question, I actually literally need to ask him to put on his psychologist hat, because otherwise he'll just make a joke. And
Right.
when the kids were growing up,
Sorry.
Go, Malky.
I think one of the advantages also, it's like, you know, I can say, Ma, like, just answer me as a therapist right now. Like, I know, like, where I'm holding, you know, and I think that's been such an advantage, and it's only enhanced our relationship because we can connect on different levels.
Yeah.
We can supervise each other, as Karen, as you know, because we're in a group. So we can supervise each other. So she'll call me, Mommy, I need 5 minutes of supervision now. But then I could say to her, Malka, I could call her up frantic, which I have, and say, Malka, you got to listen to what's going on right now.
Mm-hmm.
And I have this case, and you got to hear me out. And she'll give me very sage advice, which I'm exceptionally proud of. I have to say, when the kids were growing up, if I was on a conversation of some sort, I would hear them muttering in the background, Mommy's got her doctor's voice on.
That's great. That's
great. Like, let's leave the room. She's got her doctor voice on.
Uh-huh.
You like went right in, like you just transitioned right in.
I call Karen all the time, actually, for advice, for referrals, for thoughts. It's really nice, you know.
And I know immediately when he's calling as, like, you know, can I come over and visit the kids versus
That's amazing.
From hello.
I think I have to say what I think is
from the hello. He had you at a hello, right? Yeah.
what's really incredible with having a child, having a daughter, who, you know, has in some obviously in many respects, although she's very much her own person, as we have established. But, having a daughter who's in the same field, first of all, it's very inspirational to me that she was able to gain from whatever she gained from in the growing up, the psychological mindedness. We always had a tremendous amount of psychological discussions around the table, around the Shabbos table. So there were divrei Torah, but there were also a lot of psychological discussions about the issues of the day and stuff like that. And so it's just very inspiring me to see that, she has chosen to do this. And Baruch Hashem, she's also, like, she started out in different types of clinics and so on and so forth, but now she is involved in such good community work, doing what she does, and she can talk about that. But it's such a beautiful thing to see that it's a legacy, right, David? It's a legacy.
Right.
We started something. My parents were Holocaust survivors. They were not college educated. And they were very pro. My father, Alav Shalom, was tremendously pro-education and very sophisticated intellectually. But I was, we're all college graduates, but we didn't have education in our history. And to see that continuing now, saying, Malky's in the field, Yaakov is kind of indirectly in the field. He's an industrial organizational psychologist and so on. It's so, I say, look at this legacy. Look what they're carrying this for us. We started this, that, and the other thing, and they're going to continue it. And the piece of resistance, which is when I go to Nefesh, and people used to say to my daughter when we were hanging out together, Hindie Klein's your mother? Wow. Well, guess what? Now I go to Nefesh and I say, Hindie Klein, they say, Malky Mayerfeld's your daughter? Wow.
That's
great.
amazing.
So how much better nachas can you get than that?
That's amazing. That's beautiful. Really, it's so nice. And it's nice to see the nachas going in both directions. And actually leads me to my next question, Dr. Pelcovitz, when the world is always changing. Everything's always in flux every day. But there's, several decades of this work. What were the things that you were seeing in your clinical work? What was your experience back then, within the community, without the community, from outside the community? What was the issue of the day, and how were you approaching it then? Yeah,
so I could go on and on about this forever, but the core issue of the day, given what I was focusing on, was trauma and child sexual abuse. That's where I was doing some research, I was doing some writing, and I have these memories of maybe a little bit of the rebel in me back then, of raising it without permission at certain conferences that I go to. I won't name the organizations, right? And there being like this shocked silence. But then there've been huge, like long lines of people, of therapists or of educators or principals waiting to talk to me almost in whisper about the burden that they're living with in terms of certain horrific cases of trauma, of sexual abuse, of physical abuse. And it wasn't allowed. In other words, it was really breaking the rules to name that monster and to talk about it. And it's been so nice to see little by little the walls breaking down. The first time I spoke about this in a public setting, there were these long lines. If I remember correctly, I was up till 3 a.m. with these burdened therapists and educators, just not knowing what to do with themselves because they were so worried and needing to talk about it and being almost drunk with the ability to talk about it. But now it's gradually changed, so that going back to let's say, there I'm talking about 40 years ago, going back to 30 years ago, I remember there was almost like a rebellion where I spoke at one of these large conferences, and they put the group that was supposed to be talking about abuse into a tiny little room. And there was literally a rebellion of hundreds and hundreds and hundreds of people who came to me to hear me, and that time Rabbi Dr. Twersky, Zecher Tzadik Livracha, just to hear us, and his brother, you know, the professor. And now they know we no longer have to have that fight. It's just been so nice to see the growth and the change.
That's incredible. It's also nice to hear that. That's like a little peek behind the curtain for me, to know that there were mechanchim and therapists who were actually lining up and looking and trying to find answers even then, you know.
Yes, yes.
I think that's a little part of the narrative that sometimes gets left out, that the people were clamoring for answers.
It was so lonely for them.
It was, yeah.
And there were, and then, you know, suddenly to see, hey, you know, maybe this is a workable reality was incredible. Incredible. And were you working with victims of sexual abuse at the time in your private practice? Yeah. And of different kinds of trauma, terror attacks, etc. And one of the nice things is we had some funding to train, you know, the next generation of therapists in trauma-informed therapies. With you know, some very nice kind of funding. And the first cohort that was trained included Karen. And were you in that cohort also? No, Malky, that was, but it included Karen and a number of other people who today have really taken over, which is so nice to see also.
Amazing. And Hindie, is your experience comparable when you were starting?
Yeah, first of all, my experience was comparable. Well, I didn't do the type of research and publishing that David did. I think that what he did was very exquisite and very unusual and very important, because it was really the foundation. You know, it's kind of like all roads led to David type of thing, because we really looked to him for understanding vis-a-vis the research, the data, and the clinical piece. And, you know, and whenever he would speak, you know, as he said, people would come around and listen with open ears. I think I started out as a school psychologist, and I worked, I'm not going to mention which Hasidic community, but I was a school psychologist in a very Hasidic community for several years. And they were ultimately the subject of my doctoral dissertation, because when I got into PACE, where I did my doctorate, which was then, I think it's still called Malky, a school clinical community program. So they were very into community mental health. So we had to write a paper on community mental health. And I wrote a paper on this community. And my professor came over to me afterwards and said, you know, this is fascinating. Do you want to use them as a subject for your dissertation? Which I did ultimately. So I wrote and I studied and I wrote extensively of what it was like to work. They called me the lady. You know, the lady, because God forbid I should be called a psychologist or a school psychologist. That name never existed. So I would be told I would be doing testing and interviewing and some clinical work there. The guy said the lady, guy that said the lady. They should go talk to the lady. But they were a fascinating population to work with.
That's better than the girl, you know?
Yeah, I didn't want to say that, but I was called the girl, yeah.
Well, thank God I was a lady. So then I became very, very involved in the concept of community mental health. So,
and if I could just say that Hindie, that Dr. Klein, that Hindie's work setting up the task force and setting up, you know, the community end of things in a way that it really transformed the field much more than just about anything. There was an address for everybody to go to.
What we did was, this goes back about 26, 27 years ago, a child in the community, in the Brooklyn community, died one evening because they were inadvertently, you know, it was really a mistake. You know, it was an accident, killed by the mother. There was a huge hoo-ha. It was, and since I was at that point already directing Tikva, so they called together all the Frum directors of all the Frum mental health clinics around. So I represented New Hope Guild Tikva at the time, not even OHEL. I wasn't part of OHEL then yet. The clinic wasn't part of a whole yet. So all the various directors, we were 8, 10 people, and we all gathered around a table and we said, what should we do? We have to combat this, there can't just be physical abuse or sexual abuse in the community, and we have to do something about it. So we started this task force. It was maybe 5 agencies, 10 agencies. Today we're over 40 agencies. And our executive chair is Fegi Zackheim, and there's Dr. Schindler and Leibish Becker and Baruch Ber Bender and Joel Rosenshine and myself. And I hope I'm not leaving out anybody. We're 6 altogether. Did I say 6? But anyway, so we're a group of people, and then there's 40 agencies. And now we do child abuse, sexual abuse, divorce, all different types of addiction, sister to sister. We have a lot of different organizations, but it grew. But you should know, in the beginning, we would develop curriculums on how to go in and talk to the rabbis and talk to the principals. Because first of all, now it's different. We would go to rabbis. No, abuse doesn't happen here. In Yenim community, it may happen, but not in this community. So we had to go from community to kind of say to them, it is going on in this community. And there was a lot of denial in the beginning, a tremendous amount of denial. Now you see programs for survivors, victims of abuse, of sexual abuse, of all different types of different things. And there's endorsed by rabbis, rabbanim, endorsed by so many different, it's so different now. There's a wealth of resource, a wealth of information. Then we had to convince people, this is really going, like they would be going to listen to David and then in a clandestine way go into, can I talk to you for 5 minutes? But there was nothing organized like this, like it is today. And that's how we did it. We were the first task force. We were the very first task force. Yeah.
Amazing. Malky, you were going to say something?
I was going to say, to build on both what Dr. Pelcovitz did, let's say in terms of research, and then what my mother did along with, with others in terms of community, setting a foundation for community resources. I feel like what's amazing is that you really set the stage so that now, and I'm sure Karen, you do the same, that, for example, I can run groups for Ray of Hope, which is for adult survivors of childhood sexual abuse. And like this exists, this could have never happened. It's amazing to see the trajectory and how you could see how the generation before set the foundation for something that was so silenced for so long. And not even that many years later, let's just say, 20, 30 years later, all of a sudden you'll have an advertisement in the mishpacha for something like this. It's like unheard of. It went from whispering.
Unheard of them.
So it's unbelievable how you can actually see it. I feel like it's beautiful that we could see it,
And I have to just say one other thing, even the open-mindedness of the therapists. Years ago, there were very much less therapists, certainly in terms of the way the training is nowadays with therapy training, postgraduate training, and so on and so forth. There was David, and there were a few others, but there were very few female psychologists around from female psychologists. And I remember, this goes back, it has to be over 20 years ago. I presented at Nefesh on a panel with Aviva Bieberfeld, Nassim Solomon, and I'm blocking on his name, from Chicago. I forget his name, from Chicago. He was excellent, it was wonderful. And at the end of my particular segment, I said, when we're talking about therapy, how to do therapy, and this particular thing, we're talking about narcissistic personality disorders and how to treat narcissism and so on. This goes back many, many years ago. Now it's a common word. Everybody's narcissistic,
Right.
everybody's borderline. But then those days, they didn't understand that so well, not the therapists and certainly not the patients. And I said something about, it behooves every person who wants to be a therapist to go into their own therapy. And I remember then a standing ovation. And I said to myself, what is the big deal? Because as an analyst, you have to go through your own training analysis, which I was for many, many years. But at that time, not many people necessarily were going into their own treatments. Okay, I did my degree already. I did my supervision. What do I have to go into therapy for myself? I'm the therapist. Nowadays, if you speak to somebody, you say, are you in your own treatment? Any professional, if they're not currently in their treatment, they have been in treatment, because they understand how important, if you want to be a therapist, you need to be. But that 20, 25 years ago, I was like, really? And I had to push it. As a clinic director, I had to really encourage all my therapists to go into their own treatment.
Yeah, that might be the most important piece. You, as a therapist, you are the tool. So as fine-tuned as you are, that's as much therapy as you can, that's as far as you can take your clients. So by doing your own work and, you know, of course, growing professionally, but just growing as a person through your own work is really a huge gift that you give your clients. And I'm wondering, Karen and Malky, you know, from what you see in your practices and the issues that are coming to you today, is it the same? Is it different? How would you contrast the issues of the day?
Before I answer that, can I just comment on something that my mother said?
Of course.
So it's not.
You can always, I mean, you're being recorded. You can finally say whatever you want to your mother. She can find that.
I'm not contradicting. I'm adding a tangent.
This is very cathartic. This is very cathartic.
Because something you said kind of like struck me, which is that, you know, now everyone comes in and, you know, my mother is this, my father is that. I almost feel like, and maybe this is, you know, this is something that's just what happens anytime there's progress or advances in any field, that, you know, with any advancement or progress comes like a certain level of risk. So let's say, for example, now maybe we decrease stigma, but are we over pathologizing? Or, you know, you're having people come in, I read in, you know, different publications, it's almost like sensationalizing some of these things, or people are kind of like diagnosing on their own. And I don't know, it's just something, and I think that's maybe something Carrie and I will see more, because people are just more knowledgeable, but it's all, you know, knowledge is power. But then when does it become not a risk factor? Because I think at the end of the day, it's important to know, but at the same time, when does it become a detriment?
Right. Like counterproductive. Yeah.
It's almost like it's too much sometimes, you know, it's almost.
Yeah, there are these studies coming out about how hard it is for doctors, for MDs to practice, you know, in the WebMD or the Google My Symptoms era. It's just so difficult. Like people come in and say, I want this and that and that and that, you know, this test. It's like, you know, besides insurance won't approve an MRI because your toe is tickling. It's just like, no, you're really okay. Like, let's take, you know, but there are challenges to this. I hear what you're saying, Malky. Yeah. But I agree also, knowledge is power, and anything that people can do to help themselves be more educated and grow is definitely a good step in the right direction. Hindie and Malky, you know, or everybody, I wanted to, there's another stark difference here that, you know, Dr. Pelcovitz, though really a pioneer, is a man, and Hindie, you're a woman, you know, so that's yes, you are. So that's also something I can imagine that.
Actually.
What?
What?
A lady.
She's a lady. The lady.
The lady. It's D-E-L-A-D-I. The lady.
The lady. You're a D lady. So, you know, was it at the time that you were going for education and stuff, was that something that was different for you, that what you know, community wise, or even in the schools, being a frum female, going for your doctorate, was that something? I'm hearing myself talk. This is not like the 1800s. I understand. I'm just wondering if there was like maybe even community wise, like I just wonder if that was, did you impact in that way?
So people would say to me, like, you know, okay, so you did the bachelor's and you did the master's, like, what do you need so much school for?
Right.
Like, why are you going for your doctorate? Then when I wanted to go for the postdoc in psychoanalysis, I was a director of Tikvet, and I told people that on my schedule, because of this and this, I'm going to be going to classes or this, or all the different things I had to do for postdoc. I can't even tell you how many people asked me, oh, so you need this for your license? No. Oh, you need it for the job? They're making you go back to do this for your job? I know. Why are you doing this? No, why are you really? Why? I said, because I want to be a better therapist and I want more training. They couldn't. Nowadays, everybody's going, hello, nowadays, IFS, sensory motor, somatic, you know, all these different things. Every minute, there's like these, they're addicts. They're like training addicts. They're going all the time to all these different trainings. Yeah. In my day, if you got a doctorate, the fact that you want to go for a postdoc is like, why? You know, if you got your LCSW license, you want to go more? Like, why? Yeah. And they couldn't understand it. And I just,
Yeah.
that part. And also because you know what it is also as a woman, you're asking really as a woman. So like as a woman, so a lot of women in my era, right, they were home. They did have jobs. I'm not saying they didn't have jobs. They did have education, but they were home. They were raising their families, and maybe they were taking a course or doing chesed. A lot of people, what my friends did, beautiful chesed and all that stuff. But no one, you know, I had a friend who would call me up and say, okay, so we're going out Saturday night to so-and-so place. You want to come? I said, no, I'm doing a paper. So after a while, I became known as Peppers. They called me Peppers, like the vegetable peppers. Oh, Hindie's doing a pepper. She's always doing peppers. So all the stuff that then I was writing my dissertation. So a lot of times, like socially, I just didn't get to do a lot of the stuff that my chevra was doing, going out or going here, because I was busy with peppers. And I was busy doing whatever, you know, and I don't know, David, how you feel about it. No, as a man doing it, it's, you know, it's very
Yeah, it's just what people do, right?
It's very respectable. It's very respectable. I was a little bit, not anymore, because, you know, but then I think a little bit I was made fun of, like a little, you know, affectionately so. I Hindie with all her school, what did she need so much school for? Stay home and, you know, have a life.
Right.
And you know what I thought? I have to tell you this, and this goes for all the ladies out there who are contemplating education and moving forward and whatever. You know, everything, because I remember there were some people who were doing very well business-wise and they were very financially successful. And, you know, in our business, until you move up to a certain level, you are really not so financially successful. But I always said to myself, whatever comes and go, money can come and go. Nobody can take away your knowledge and nobody can take away your education. Every letter after my name, nobody can take that away, ever. And that to me was always very inspirational. Right. I make more money, I make less money, I do for the klal, and I have my own knowledge, and no one can ever take that away from me.
That's amazing.
That was to me very,
Thank
very
you.
important.
Wow, that's beautiful. That's a very empowering message. Thank you, Hindie.
It's a very important message for women to hear, I think.
Yeah.
Okay.
So back to Karen and Malky about the issues of the day that you feel like that you're seeing today. What are the things that would you say it's the same, it's different? How would you contrast it? Karen?
What do we think?
I mean, you know, it's hard to contrast it from, you know, certainly the, you know, we already discussed the idea of how, you know, the decreased stigma, but that there's still clearly issues of abuse in the community and obviously still a ways to go in terms of that. So I wouldn't necessarily contrast it in that sense, but I guess one of the things that we were talking about was the issue of excuse me, was the issue of sort of helicopter parenting and how difficult I think it is now for parents. And I think, you know, I guess I'll turn to my father and Dr. Klein in terms of, you know, maybe verifying this, but I think that the pendulum has sort of swung in terms of how, to what degree that is an issue. In other words, the degree to which it's hard for parents to see their kids uncomfortable, or that parents feel more of a need to sort of swoop in and protect their kids when they're going through a hard time. I think that's something that, you know, I certainly see, you know, now, you know, and I'm sure it was always an issue to a certain extent, but I think, you know, to an extent, I think maybe the pendulum has swung a little more towards that being more difficult for parents.
Yeah, that's definitely a major change. When I started, you just didn't see that. And it's now such a intense sea change in terms of the way society works. You know, so you know, the balance between love and limits, you always want something in the middle, right? All love, no limits. Kids grow up to be overindulged. All limits, no love. Rules with that relationships equals rebellion. And you want it, you know, the research shows you want something right in the middle. And it's not what's
Dr. Pelcovitz, you got to say that again slower, because I've heard you say it a dozen times, but it's so
Very
profound and so beautiful. Just say it again. You know what I'm talking about, right?
Rules
Rules without
relationships equals rebellion. And that's very much where the most massive change has been in society. is in terms of the inability of parents to be able to see their children struggle, to be able to see the health of a child, not necessarily having their parents swoop down to defend them if they get in trouble in school or they're caught cheating on a test. It's crippling to kids. And that's changed things in a way that together with social media has totally changed, I think, the field of therapy. Now, is it worse in our community than in the general community, in the frum community and general community? I would think maybe a little bit. There is some research on it, but what is Darlene Ettengoff from OHEL? She has a daughter who did some actual very nice research. She did her doctorate on that, and there's reason to believe that it might be a little bit tougher in our community. But boy, is that a change that makes life a lot more difficult. I have another daughter, and then I'll stop. I'm sorry. I have another daughter who is also a psychologist. Somebody said I should check my mezuzahs, but she was just telling me today about how she made some referrals that she checked with me about, but she's in her own right very able to find the best people. She's at Cornell, where she has access to some of the leading people in the field. She says people don't accept the referrals she's giving because they'll go online and they'll see, well, they only have X numbers of publications, or no, they, the reviews online are just not so, are not as impressive as they are with this other person. It's just like, it's a shift, anyway.
Yeah, no, David, I wanted you actually to comment. I have some thoughts about technology also, but I wanted you to maybe also continue that conversation on technology and how that has affected the field, how has it affected the frum field or the field of what it does to you as a professional, what it does to the patients, what it does to the patient-therapist relationship. Like you said, it used to be anonymity between patient and therapist. Now they know all about you in 5 seconds. So I don't know if you could comment on that, David.
No, it's just, it's a sea change, they'll know, they know everything about me, and whatever might be online in terms of both negative and positive. I wrote a letter for somebody who was being sentenced for a crime that he did. But I wrote a letter like, hundreds of people do when somebody's about to be sentenced, not saying the person shouldn't be sentenced, but asking the judge to temper, mercy and compassion with the midas hadin. It's something that I used to do all the time. But then the cancel culture took over, and it was terrible. It was like really my kids came to my defense, and it was very nice. They actually protected me, so I didn't have to worry about it. They went online and counterattacked, and now it's nothing. But for a while, it changed things in a way that then when you would look me up, you wouldn't think I had anything to do with fighting abuse or dealing with trauma or whatever. All you would see, oh, this guy, he loves he loves abusers. He loves abusers, and they say terrible things that people would take as truth. And that was a nice intergenerational thing, because my kids understood it better. And then there was a tremendous amount of backlash against the people who were going after me in terms of support. People like Yankee Horowitz, colleagues really came to my defense, and now it's like it's like nothing now. It's like it didn't happen, because people understand better how this could happen. But it changed things, and it meant that and it was fine. I mean, it didn't, but it was hurtful. And it gave the worst part is it gave of an hapachu, the opposite kind of impression to anybody, any of my clients who wanted to know a little bit about me. They looked on it, they then call me and say, I didn't realize that you were in favor of supporting pedophiles. And it could get you crazy because it's the opposite of what the truth is.
Right.
But anyway, yeah. Remember that, Karen? Okay, yeah.
That's
Yeah.
hard. The exposure that comes along with it, and just, everything is so transparent that it's challenging at times to be able to navigate. And, like they say, don't believe everything. On the one hand, we want this culture of advocacy, like at Amudim, that's really important. We want people to be able to know that they can get help and they can stand up for themselves and they can get what they need. But then there's sometimes where there's things are not always so clear.
The nuance could be lost when it comes to, social media, in terms of social media, or I guess just, online, in terms of so many things. It's kind of, it portrays things in such a black and white way, obviously in this area, but also in every area. The whole idea of social media being, it's just this sort of very narrow, slim view of, what life is, and like these picture chats really, I see so tremendously on how when kids are exposed to that with any kind of regularity, it just makes such a huge impact on how they view the world and their expectations for what things are supposed to be like. And it just that lack of nuance becomes such a huge issue, I think.
What do you tell the parents who you're working with about how to control that, or how to deal with that force in a way that's healthier or more effective?
To ask you, I don't know. I think that having conversations about it is such a huge piece of it. Meaning, I think so much of this is talking about it and being able to name it, because if you don't, then it becomes just the reality, and when you see it, you just assume it's true. But when I do think in a very positive way that schools and communities are doing a much better job as phones are becoming so much more pervasive, and there's a growing recognition of that, of it being an issue. I think that the conversations are starting, and you can get kids really going. Teenagers I see really going on getting on soapboxes and talking about how, I really don't watch it. I don't go on social media too much because I see that it's so fake, or they do, but they at least are having the conversations. And I think that just that makes a huge difference.
Just like along the lines of social media, like another element of it is that I see people who on the one hand will find like a community of people who are, let's say, suffering from something that they are. But then again, on the flip side, it's like, okay, how much are you now associating with this? And like, I found my voice, but in a sense, it's almost not leaving room for like nuance, like you said, or subtleties or variations. It's like, I belong to this now. Well, maybe you don't 100% belong to it, So it's creating community, but then again, is that community, are they defining themselves too much by that community?
I think that in many ways, listen, technology and the internet and so on can be so incredibly educative and informative and rich with knowledge and understanding of certainly many things. But I think that the social media aspect, although like Malky said, it could create a sense of community, a group, a chat or whatever. I'm very against Instagram, if I may say that. I don't have Instagram. People will say to me, you have Instagram, you have Facebook. I refuse to go on Instagram. I refuse to go on Facebook. I hear it from my patients. Oh, you see, I saw this one on Instagram and she went on the yacht and on the trip and on the thing. And meanwhile, the patient is terribly depressed because she's not living that life, which is most probably, who knows how much percent fake. And it gives it just sends, I think, in many ways. Now, I'm not to say that I don't love, certain aspects of technology and the internet and learning and growth. But, there are certain things that I find could be very, very destructive. And I think, well, like Malky said, you could join a group, but then all of a sudden I'm like-minded, like that group. I'm just like them. But guess what? You're really not 100% like them. You know, where is all the exploration of finding out who you are for you? Yes, I joined a group that is, you know, they're you know, survivors or depressed or whatever. But that doesn't define you. You know, there's so many different facets of what defines you. And I think that could be very destructive, you know, on the in the technology form. We didn't have that problem. David, did we have that problem? Did we
No,
have that problem with technology and the internet when we were young?
no, it was a much less complicated life. It really was. And look, you know, let's just look at the research for a second. You know, the heavier the user, for girls in particular, of TikTok or Instagram or Facebook, the higher the level of depression, the higher the level of anxiety, and, you know, every single measure. And, you know, when you see some of the work of, especially out of MIT, you know, the who wrote Alone Together again? Sherry Turkell. So her stuff it's chilling to see that as, you know, the first generation who was born to the iPhone started to come of age, you saw a tremendous increase in every major psychiatric diagnosis. So,
Wow.
Interesting.
That's what I love about David, because we all have commentary, but David backs it with research and data,
all made up.
which I find always incredibly enlightening. And
That's great.
you know, yeah, it's just wonderful to have, you know, David Pelcovitzes are very few, if any, and far between. Yeah.
So in the time we have left together now with, you know, two amazing parents and their, you know, two amazing daughters, I wonder if you would each give us, like, what would be your 2-minute message to, or less or more, but message to parents out there, you know, people who are trying to parent their children, their teenagers. What would be your message to them today? Could be a guidance, tip, idea, what you've seen. What would be that, you know, that golden nugget that you would want to share with them?
I mean, there's a lot to say. And obviously you want to just love your children as much as you possibly can. But if I'm thinking from like a psychological therapist perspective as to what I think would help, sometimes I think, especially with, you know, with kids who are, let's say, more involved and there's a lot more going on. I think one of the things I really learned is that, like, it really takes a village. Like, you know, therapy is amazing. And I think everyone here has worked so hard and is so dedicated and has made a difference in people's lives. And at the same time, there are so many, because of the way maybe things have developed now, so many resources, like, for example, like Amutim, obviously, and all these other things that are now available. And let's say we have research that came out, you know, over the years on things like yoga or meditation or whatever it is. So in other words, be there for your child, support your child, and also know that there are so many available options now to give your child if you think they need additional support. And I just think that's really nice to know that sometimes it takes different factors to kind of facilitate growth in a child. Talking about kids who maybe need more support, you know, in particular.
So I would go back to the first year of life and talk a little bit about attachment, because that to me is the most probably one of the most, if not the most important aspect of being able to mother, nurture on a variety of, you know, there's attachments, but you need the attunement, the empathic attunement of a mother to her baby to create a healthy attachment. And if you can create a healthy attachment and a fine attunement in the first year of life, the first 2 years of life, the child has so much better, there's so much better a chance for that baby and that child to grow up with a healthy attachment and healthy and stable. And then obviously on through the life cycle, if I had to say, which, you know, presence, be there, sit, you know, sit with your child, sit with your spouse, sit with your friends, just be present for, you know, and like, I know David talks about, you know, shutting off the phones. I always talk about this, my little metaphor of, in the old Westerns, they had saloons, and in the old Western movies, they had saloons. There was a sign, guns at the door. You weren't allowed to bring your gun into the saloon, like in these Western movies, 50s and 60s. So it's a little bit before many of whatever time. But now I always say to parents who I'm telling when they want to spend those extra few minutes with their child, I say phones, instead of guns at the door, phones in the drawer. Put your phones away for 10, 15 minutes. David, you're going to comment on this because David has the most beautiful way of saying it, heart to heart, eye to eye. Sit with your loved one, whoever that is. We're talking about children, and sit with them and look at them and feel them and experience them and spend as much time as you can with them. So the presence and start at a very early age.
Amazing. Karen?
Yeah, I mean, I would have to just, continue, I guess, with that theme of communication, because, it really is, I think, just such a huge piece of connection. And I guess, sort of continuing what we were talking about before in terms of being able to, not necessarily solve the problems, not necessarily be able to get rid of them, but to be able to sit with, I guess if we're talking about from a parenting perspective, with that child and just hear them and be with them. I think that's a hugely important piece.
Amazing. Thank you. Dr. Pelcovitz?
Yeah, I mean, to just I have a million stories running through my head, but I'll just share the reality that kids very much are today more likely to complain about their parents' lack of availability than the other way around when you look at it. And there's this beautiful thought that the Piaseczner said in the name of the Baal Shem Tov, that when we say in Shema a number of times every day the words Va'avadetem Mehera, he says we have to think about it as get rid of the rush in your life. You all have to figure out a way to get rid of the rush, to find a place, as we're all saying, we could center ourselves, we could be there, we could look in our children's and our spouses and our friends' eyes and look in their hearts and be able to get rid of the rush and be present. It's not so simple today. It's you're an expert on breathing, and I've been breathing now for 71 years, and it's still very
Esrim.
huh?
Esrim.
Amen. Thank you. So anyway, I think that it's I think it's the most important message of our day is awareness and presence and the Va'avadetem Mehera.
Can I just jump in with a story that I heard actually from David? David, I'm trying to remember because I've heard so many of your phenomenal, glorious stories. But you once told a story about this couple who went to the Gottman Institute in Washington for that retreat weekend.
Right.
And they were sitting at the Gottman in Seattle, or wherever it is, and they put you in these little apartments while they're working with you over a period of days. And you have your own little apartment, and it's all very beautiful. So David told the story of a couple who was sitting there in the morning getting ready, I guess, to go to work with John Gottman and his wife, Julie. And she's looking out, it sits on a campus with a beautiful pond or a lake or something. And she's looking out at this lake and saying, it's so beautiful and it's so serene and her husband's sitting at the kitchen table, he's reading a newspaper. And she looks out and then she turns to him and she says, she goes, aren't we lucky that we have this opportunity to be here together and to go and to work with, Dr. Gottman and to get this help for ourselves and whatever. And he's sitting behind the paper and he's going, And she was trying to kind of get a connection with him and his presence, and he was just kind of nodding behind the New York Times or something. But you gave it a term.
Turning, it's Gottman calls it turning towards.
Turning towards.
And Rabbi Frand heard this, right, once shared it with them. and he says, where's the first time in the Torah that you have the term turning towards? And he says, Vel kayin vel minchaso lo shah, that shah is the Hebrew term for basically, in that sense, turning towards. And that lack of turning towards literally triggered the first murder in the world. But then he talked about the other way of looking at Shah. Yesh Adam Kona Olamo b'Shah Achas. You could attain Olam Haba with one turning towards. You see somebody in shul on Shabbos who doesn't have a place to eat, and you're really not in the mood for it, but you turn towards them and you invite them. You see a friend who is having a hard time, and you could easily pretend not to notice that, but you turn towards them. Most importantly, we see our children, or we see our parents, or our spouse, or our friends, or our clients needing that extra kind of shah, of turning towards. And that's the essence, I think, of what we've been talking about all night here.
That's great. Thank you, David.
Thank
Thank
you.
you. Thank you.
Thank you, Dr. Pelcovitz. Thank
Malky,
you,
thank
Dr.
you,
Klein. Thank you,
Amazing.
Dr. Mayerfeld. Thank you, Karen, Herrmann. This has been incredible. You're all really inspirational. Your words, your work, your legacy, it should continue. Thank you for what you all do for Amudim as well. We deeply appreciate it. The support is not taken for granted.
David encouraged me to join Amudim. Remember, David, I called you.
Yes, yeah. Right. Thank God you can. And by the way, can we take a vote on which family is better?
We're going to do it on social media.
Okay, great.
You're going to have to post pictures and hashtag it and all of that.
The
But-
Klein family is definitely amazing.
Oh,
So is the Pelcovitz family, so we're all okay.
The Pelcovitz family is beyond, and that goes for you too, and for Lonnie and for everybody else. So it's
Fantastic.
this is a tremendous. I loved having Malky and Karen on board here. It was amazing, and David is my idol. So
And it was a great, and Hindie, really, it was your idea, this program. It was an excellent idea. Thank you.
it's kind of fun.
Thank
Yeah.
you. Thanks, guys.
Thank you all.